turn it over to Cynthia. So it's all yours.
Thank you. Good morning, everybody. My name is Cynthia Shannon. I am the Director of Business Development for Cherry Blossom Pace in Alexandria. Um, so I will warn you, I could talk about Pace all day, every day. My poor husband has to listen to me. I think Pace is the best kept secret in Northern Virginia. So I am honored to be able to come and tell you about it. Just to give you a quick history, Pace was started about 50 years ago outside in San Francisco with the goal of how do we help a population who was aging, needed more resources, but did not want to go into skilled nursing facilities. So that was how PACE was created. PACE stands for Program of All-Inclusive Care for the Elderly, which is kind of funny because you have to be 55 and I'm 63. So if someone calls me elderly, I'm going to be upset, but I'm old enough to be in PACE. But that is where the term comes from. So PACE is now in over 30 different states, and there's about 130 different PACE programs, just to give you a quick little history. So at Cherry Blossom Pace, which we opened our doors just about 5 years ago, our goal is how do you help people who have a high level of need but don't want to live in a skilled nursing, because by rules you have to qualify to live in skilled nursing facilities to qualify for PACE throughout the country. Every state has different requirements. Virginia's has some of the highest requirements of needing help with their 5 activities of daily living. And there's only 6. So you can imagine that's a lot to have someone to need help with. But nobody wants to spend the rest of their life in a skilled nursing facility if there is a way to stay at home. And that is our goal, to help them stay at home till end of life. So our participants should be allowed to figure out how to stay at home, and that's what we're here for. So when we look at a PACE participant, what we're looking for, sorry, I want to switch to the next slide. Why are you not doing this? Sorry. Oh, here we go. As I said, it stands for a program of all-inclusive care for the elderly. If you know anything about Kaiser, you kind of know the model of PACE. So we're an all-inclusive plan. So we are the insurance company, but we're also the healthcare company. We're the transportation company. We're the home care company. We're the medication management. We're the primary care. We're the nutrition. So there isn't anything we can't do. We're the social workers. So we do all of this for our participants. And with the goal, once again, of how do we keep them at home if they're getting proper care. When you, and I'm going to put, because I always forget to say this, if you've never come to the PACE Center, please know that doors are open. I love to show off our center. Everything that you could get if you were in a skilled nursing facility, you can get in this building. We have therapy here, physical therapy, occupational therapy. We have the socialization. We have a clinic, so we can do primary care work, such as blood work, urinalysis. Like I said, we serve lunch, so we have the social aspect. But the only difference is our participants do not live in this building. They go home. Every day, Monday through Friday, our transportation picks up those who want to be at the center and brings them in, and then brings them home, but they do not live here. We also handle all of their doctor's appointments. So we set up their doctor's appointments, we pick them up, we take them to them. And so that's the big thing. I know a lot of times with the volunteers, you're taking to multiple doctor's appointments. We can take care of that. Like I said, we have the on-site visits, and we also have the home support. The majority of our people are on, ours are truly the underserved seniors out there. So these are the people that are on Medicare and Medicaid. We will get them through the process of getting on Medicaid if they would qualify for it, doing the medical screening, the application. I luckily have a Medicaid specialist on staff. Here's the big thing. To qualify, you have to be 55 and older. You have to reside in our service area, which means they're done by zip codes. Every part of Arlington is part of the PACE program. There isn't a single zip code there. We also cover Eastern Fairfax, Alexandria City, and parts of Alexandria that are in Fairfax County. Whoever did the original application missed the Mount Vernon area, so that does not have a PACE program, and we cannot, by the rules set up by the state of Virginia, we cannot work with the people who live there. I know, seems really weird. And they have to be able to live safe in their community. One of the things that we always look at is if there was a fire, would this person know how to get out of their home? Could they get out of their home? We recently met with someone who was a brand new amputee who wanted to get out of the skilled nursing facility. Unfortunately, he lived in a building that had no elevator, and there was no way he could get in and out of his building once he went home. So we've been trying to work with him to help him find a new place to live. As we all know, when you live in an affordable dwelling, the lists are long to get into one. But he wouldn't have been safe for the skilled nursing facility to send him home either, because he couldn't even have gotten into his apartment. He lived on the second floor. So that is what we mean by safe in their community. These are part of what we call the IDT team, and I can never say interdisciplinary team, but these are the people that are part of that. These are the smart people. This is not me. So this is the primary care doctor. We have a nurse practitioner. We have a home care coordinator. We have a center manager. We have a recreational therapist, social worker, physical therapist, occupational therapist, nurse. Did I miss anyone? I don't think so. I think I got everybody. So there's 11 people who get together when meeting with the participant and their family to develop the care plan. What is the care plan? How many days are you coming to the center? How many hours are you getting care? How often are you getting care? What days are you getting your medications? What do you need for meals? We're able to provide mom's meals for those who are food insecurity. So we're able to get them those prepackaged meals. How many meals a week do you want? So these are the people who are really what medical equipment do you need? You need a new walker, you need a wheelchair, you need as most of us would call it a life alert, but we call it a PERS. The response system, do you need that? Do you need railings in your house? Do you need a ramp to go into your house? All of those are things that PACE would provide at no cost once enrolled in the program. So these are just the different services we've provided. Like I talked about, primary and specialty medication. Like today, the podiatrist is here, and any participant that is here is being seen by the podiatrist. Prescription medications. We have all of their prescriptions delivered to their homes. No more standing in line at CVS or Harris Teeter. Transportation, like I said, to all appointments. Personal care, bathing, grooming, just like a home care person normally does. Social work and emotional support, nutritional counseling. We have the day center, and like I said, all medical equipment, physical, occupational, and speech therapy. This just happens to be one of my favorite people who just told us what she's been able to get from joining PACE. Just without PACE, she doesn't feel that she would ever get to where she is now. So like I said, they come in, they do housework for her, they do some light food prep for her, getting her to and from her doctor's appointments. I think that's probably one of the biggest things that a lot of our people on a fixed income of is like paying for an Uber, paying for a taxi every time they need a doctor's appointment. So those people who are constantly missing the doctor's appointments, that leads to more health issues. So we want to make sure they get them there. And our person, actually, we have a person whose job it is to set up those appointments so that you get to them. Because we all know that I know for me, I always push off getting a doctor's appointment when I need one. So just to give you a little heads up on Arlington, so about a third of our participants live in Arlington. For those, I don't know if a lot of you know what happened with Culpeper Gardens gave up their assisted living license as of July 1st. So we stepped in and have started supporting those residents that were in assisted living, and they have now joined the PACE program, so they got to stay in their homes, which I think was a big deal, because where are they going to go? If they needed assisted living, the other communities in this area have long waiting lists. So we were able to keep 15 to 20 of their participants living in their homes, providing the support that they needed, and getting them to be a little bit more independent. And so I think that's been a great relationship we have with them. And we also partner with, I don't know why it says five, we have way more than that. Partnered with skilled nursing and affordable dwellings. We do a lot of work in all the different affordable dwelling apartments in Arlington, doing presentations, going in and speaking to them. As I think I already told you, PACE is in 33 states, 380 PACE centers, 100,000 people participate. There should be way more. Average age is 75. It's more women than men, and 94% live out in the community. Like we have one person that's in our program that lives in a skilled nursing facility. Um, on average, just for those of you who like numbers, we save the state of Virginia a lot of money because we're keeping these participants out of the hospitals, out of the skilled nursing facilities, um, because they're not using the emergency room for primary care anymore. They have us. We're available 24/7. They take a fall, our nurses go out and see them the next morning if they fall overnight. We bring them in here if they've had a medical issue. So by keeping them out of the emergency rooms and keeping them out of skilled nursing facilities, that in turn saves the state of Virginia's Medicaid a lot of money. Um, and just for families, just like I said, you have a dedicated care team. You know exactly who you're talking to. So if you need to talk to Carla, the nurse practitioner, you can call and talk to Carla, the nurse practitioner. You're going to get regular updates. We are going to be, they get an assessment every 6 months. So if the care plan, any changes need to happen. We also give access to respite care. Family goes on vacation. They've been the caregivers. They need to go away. Caregiver burnout is real. We will provide respite care where we pay for the person to go, might be to a smaller assisted living group home for the week. It might be a skilled nursing, or daughter and son just want to date. So we'll provide care on that Saturday so they can go out on a date regularly. So those are just some things that we do to help support the family. Like I said, our phones are available 24/7. So if something happens overnight, we're there for them. And then this is the best way to get a hold of us. Like I said, we're in the Mark Center in Alexandria. You can email me at info@cherryblossompace if you have someone you want me to talk to, or give me a call. So that's PACE in a nut, a little small, but now I'm going to go into really much more that the sideshow doesn't cover. So Medicaid, like as I said, Medicaid and Medicare is what truly pays for us. So if someone qualifies for Medicaid, that means they make less than $2,900 a month and have less than $2,000 in the bank. Those are the financial requirements to be on Medicaid. And then we do the medical screening to make sure they medically qualify. As I mentioned earlier, you need to have 5 of your activities of daily living. That's your grooming, your eating, your dressing, your driving, your medication management, your walking. Those are the things they're looking at. So it may not need that you need someone to constantly do everything for you, but you might need reminders to take your medication. So that would be an activity of daily living that they're looking for and that you need assistance with. Once we get all of that, we submit the application to the County of Arlington for you. Unfortunately, it takes about 45 days for a county to come back with the decision of whether or not you're approved for Medicaid. If you are approved for Medicaid, that does not mean you may join PACE. There are other programs out there. We are just one of the ones that accept the Medicaid. There's also a thing called an CCC plus waiver, which is for people who need much more home care. They might need 50, 60 hours of home care a week to be able to live at home. We will counsel them through what's the right program for them. Once enrolled, because we are the insurance company, we can only enroll on the first day of the month. So that, just like, remember when you started a job, you always started your insurance on the first day of the month. So it's the same rule we have to follow. You can only start on the first of the month. So people we are talking to right now, we're talking about October 1st for them to enroll. Nothing we can do about it. That's just the way the system in the state is set up. What have I missed so far? I don't know if I've missed anything. So maybe if you have some questions, it might remind me of what I've missed. Gary, do you have any questions?
Yeah, and I think you've touched on some of them. The first one was you said you were an all-inclusive care and health insurance provider. Well, what happens if somebody needs specialized care that you don't provide? And you've already talked about you take them to doctors.
Yeah.
So I assume that's the answer.
Yes. We will set up their appointments to see those specialized cardiologists, neurologists. We have people that we take for dialysis. Yeah, so we take them to all the specialist appointments. They just like your typical HMO kind of thing, that doctor has to be one of our providers. So all of the ANOVA doctors are our providers, and then with the VHC doctors, a lot of times we have to get them to sign an agreement for that one participant. But I always like to
Now
say
you,
VHC because Arlington is a big VHC area.
now you talked about seeing if people qualify for Medicaid. Do you also take people who are on Medicare? What's the requirement for
If
that?
they're on Medicare, that means they're privately paying. So if you think about, and I'm not gonna even sugarcoat this, it's about $8,100 a month to privately pay. So Medicaid is truly the best. If somebody was in the process of trying to do, like, say, a Medicaid spend down, where they want to spend down their money to qualify, they can privately pay to help with that Medicaid spend down. So there are people, when you're over assets, but your income is low, sometimes you've been able to save some money, but Medicaid will not even look at your application if you have more than $2,000 in the bank, and they will find it. So I'm talking bank statements, life insurance policies, cars. I always want to say this. People always think you can't own your own house. You can actually own your own house. You can actually own a car and still qualify for Medicaid. You just cannot, your home cannot be worth more than $700,000 in Northern Virginia. But everyone used to think they used to have to hide the house, put the house in the kids' names and things like that. You do not have to do that. And they will look back at that. What the people who work in the Medicaid office will always look at when they do a look at your last 3 months bank statements, they're always going to question, what are these $500 or more things? So if you're giving, like, they can tell what your rent is, right? If you're paying your rent. But if they think you're handing money out to grandchildren and your children and all of that, they're going to say, no, 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 you can't do that. Can't give away your money. You have to use it on yourself.
Okay, do you take long-term care insurance payments?
Long-term care insurance will not pay for PACE because we're an insurance and they're an insurance. They will
Okay,
only
what
pay for
about if
they only pay for care.
okay, what about if somebody has TRICARE instead of Medicare?
Yes, you get to keep your TRICARE, but you would still want to qualify for Medicaid. There
Okay,
is,
otherwise it's the same private pay as somebody on Medicare?
except the Elizabeth Dole Act that was signed by President Biden in 2025 as he was leaving office says that the VA is supposed to pay for PACE. However, nobody at the VA hospital is quite sure how to do that yet. So I've been working with them on that because I am married to a disabled vet. So vets are really important to me, getting them the care that they need. Um, but so if you qualify, if you're a veteran and you are not connected to the VA hospital in DC or at Fort Belvoir, I'm going to urge you to do it. Just get connected so you have something to do with it. A lot of times when we're TRICARE for life, we don't consider getting connected to the VA hospital because we can go see doctors. However, there are a lot of services for veterans that they don't know about because they haven't been connected. The VA actually pays for home care. So that's my soapbox on veterans, but so many of our veterans down in Northern Virginia do not even think about it because they're retired and they have TRICARE. So take the time to get connected to a primary care and a social worker over there. I beg of you. And I can send Gary a document on how to get connected so you'll have it if anyone ever has that question. I have the steps done.
Now, you talked early on about all of the different um, things that you you can provide at your center, and the question here is, what's your ratio of primary care physicians to patients?
We have one primary care physician and one nurse practitioner. So we have two providers in the building. We have 72 participants. So our primary care doctor and our nurse practitioner, this is the only place they practice. They are not holding some hours here and then going somewhere. This is their sole practice. So there isn't a ratio because They're not doing, like some places you go, the doctor has multiple doctor's offices. This is it. This is where they are at. So no, there isn't a ratio because they can see everybody. Plus we have 2 nurses on staff. Once we hit a certain number, we'll bring in more nurses. But right now the provider list is we have 2 for 72 people. So as you can see, that's a pretty good ratio.
Okay, that's looks like all of the question. What is the specialty of the PCP? Um, and they
Yes.
asked, do you have gerontologists?
Yeah. The nurse practitioner has a background in gerontology.
Okay.
And our doctor does have, is able to, what's the right word I want to use? Is at Inova. She's in Inova, like she's registered in Inova, so she can get into the hospital. She can see if our participants end up in the hospital, she can go in and see them there. She has rights to their privileges. That was the word I was looking for. So she has privileges at Inova. Just to give you an understanding a little bit more of one of my favorite stories is we had a participant who needed a new knee. So our transportation picked her up, took her to the hospital. She had the surgery. She got the new knee. She got picked back up. She went into Leewood rehab for 2 weeks for, strong rehab to get her back up and get her walking, get her moving, and then came home and now continues her PT here. Her cost was zero. We covered every part of it. So once enrolled in the program, there are no copays. There are no deductibles. There are no max out. You cannot max out the amount of care. If you're traveling and you need to go to the emergency room in Arizona, we cover that emergency room stays. There's no, like, you don't have to worry about that kind of stuff. If you're going to, we have a lot of Parkinson's in this area, so you're going to a neurologist, we are covering that. And they're just communicating to us when you need different medications. But yeah, there isn't anyone you can't see. We have people who are going to see therapists. We are covering that because mental health is also a big deal. We have people who have
What
addiction
if
issues.
somebody is traveling out of the country and have a medical issue?
Yeah. We stop at the border.
Okay.
Any other questions?
I don't think so. I'm sure there will be, but that's all we've got lined up for now.
Yeah. So like I said, if you ever want to come in and see the center, just email the email that you see on. I'm more than happy to show you around and show you because I think seeing the building is really helps you to see what we actually do here as I'm talking about it so much. But if you are one of those people who volunteers and is driving someone and you think this person is just their care level is getting to be too much for them, they're talking about missing a lot of appointments, that is someone to say, hey, let's have you talk to Cherry Blossom Pace. They might be able to help you. Like I said, if we're not the right program, then if we're not the right program, we're going to make sure we counsel you to find you the right program. I just saw a question come up. A
Yeah.
CCRC is private pay. So it's depending on which one you're looking at, those are going to be, they can be anywhere depending on what level of care you need. They can be $10,000, $15,000, $20,000 a month. But that's also because it's paying for your apartment, it's paying for your food, it's all different things. I can't do it. Our cost, if you are not eligible for Medicaid, is $81.68 a month. That is what it costs. And that covers everything, but you're still paying your rent. You're still paying for some of your other stuff. We're not paying for the things that are included in a CCRC. It's a just totally different model. But I think one of the things I would tell you for someone, if you've ever had this happen to a loved one or a family member, if, for example, you move into a skilled nursing facility because you can no longer be at home, what ends up happening is you end up giving that skilled nursing facility, even if you do qualify for Medicaid, your Social Security. You give them all your money except for $40. In the PACE program, we do not take your money. You keep your money because you're living at home. You need to be able to pay your rent or your mortgage or whatever. So we aren't taking your money. That's one of the big things I can always tell people because I think that's what always when people are like, well, how much of my Social Security do I have to give you? Does that make sense?
Hmm. Are you guys expanding or are you pretty much static the size you are?
No, we're expanding every month. We're about to open an alternative site at Culpeper. So anyone could come into Culpeper that was enrolled in the program there. So if they live in Arlington, it might be, so if they want to see the nursing staff there, they could go there. So we're going to do that. Unfortunately, we can't expand our coverage area because the state has to put out the request for people. Like Prince William County has no PACE program whatsoever. You would think they would have like 3 or 4. You get to the Fair Oaks area of Fairfax, Reston, Herndon, nothing. The next closest PACE program to us is in Winchester, Virginia, and it comes to about Sterling. So you can see there's huge gaps that we're working with the local state legislators to show them like, we save you money, you need to increase that way, but there's huge gaps in the state, unfortunately. But if you ask my CEO, he would like us to have about 300 participants. Because we do own 2 other PACE programs in Oklahoma, which they do have about 300 participants. Very quiet group.
Okay, I don't see any additional questions. Can you give us a little bit of background on yourself? How did you come to be where you are?
So I have worked in what you call the senior housing and healthcare market for 6 years, because who doesn't go in it during a pandemic? So I have done everything from assisted living through hospice. I am a salesperson. I'm never going to lie about that. I have been selling since the dinosaurs roamed the earth. But so I am truly a salesperson. I came to Cherry Blossom Pace just about a year ago because it is great when you have lots of money and you can afford to go into and pay for home care 24/7, or you can move into a beautiful assisted living community or CCRC. But what was happening to the population that I kept getting calls from where they didn't have the money? And I kept saying, do you know about PACE? Do you know about PACE? So I kept referring people to PACE. And then I saw this director role open. And I said, you'd all be crazy not to hire me. So they actually believed me and hired me. So I do believe in what we do here. I see our participants' lives change by just coming in here and being with other people, socializing, by getting meals, by getting their medications regularly, getting off of medications that doctors are overprescribing them and our doctors working with them. I've seen people who had no money in their pockets because they just didn't have a plan, and our social worker building them a budget, and now they have money and they've got pep in their step again. It's just, I've seen people who are afraid of doctors learn to trust our doctors and get the care they need. We had one woman who had a growth all over her face. She had such a fear of doctors that she wouldn't go and have it seen. And now that growth is gone and she wants to be our ambassador and go out and tell everyone about us. So that's why I always joke we're the best kept secret, because people just don't know we're here and don't know all the things that we can do. So that's my background. I'm originally from Boston, so if I'm talking fast out, we'll explain that to you why. Anything else? But yeah, I love this place. I truly believe in what I do here, and the clinical team does and what they do to save people. And we're right through end of life. We've got one on hospice right now that the team is there with her and with the family, supporting them through this.
Now, there's another village in Alexandria called At Home Alexandria. Do you guys have any kind of a relationship with them?
I did in the past, but since the executive director changed, I have not been over to see her yet, meet the new one. We did just do a presentation for Mount Vernon at home, even though they know we don't cover all of their area. They've come in and seen the center. But yeah, I'm a huge fan of the villages. The villages are our people. Those are the ones they want to be at home. So yeah. But yeah, I used to work with CEO all the time over at Home in Alexandria. one of the things I'm going to be honest with you that makes people nervous is we're asking you to change everything that you know about the way you've been getting care and trust us. So it's scary. So we're asking you to switch your primary care. You don't have to, but we're asking you to switch to our primary care doctor. Sometimes they want to really stay with theirs until they get to know ours and trust ours. But that's a lot to ask somebody who's had a relationship. And I think that's one of the things that makes most people nervous about making this change. Is that I mean, I love my primary care, so I know I would be nervous if someone told me I had to switch. And every time I've changed a job, I've always checked to make sure my primary care is on my insurance. So I understand that concern.
So I was going to tell people, Cynthia said she's got an electronic copy of their pamphlet that she will send us, and we'll make sure that the office has that if anybody's curious to get a copy and take a look at that.
I'll definitely send that over to you. And if there's, like I said, don't hesitate to call if you have any questions. I'm always I'm always happy to answer questions. Um, I'm always happy to give a tour. I'm always happy to come speak to anyone. If you have other organizations that you are part of that you think might benefit from us coming out. I have a person whose sole job is to take care of Arlington. So she's going around to all of these apartment buildings. She's going to these churches. She's going there. So anytime you want any of us to come do, even run a bingo game, we're more than happy to.
Now, do you ever have people join PACE and then leave because they're not happy with it or aren't getting what they thought they would be getting?
It does happen. It doesn't, it has happened here twice since I've been here. And it was actually, one of them was a person who unfortunately had an addiction issue and was drug seeking. And so when he wasn't able to get the medications the way he wanted it, he wanted to be able to go back to going to the emergency room and getting the medications every time he needed. So that is not someone who's probably the best fit for us. And then the other one was she just decided she wanted to keep things the way she had it. She had had home care through what we call the CCC plus waiver, and she wanted way more home care. And so she went back to that program. But majority of our people, the reason they leave is either they move out of the area or they pass away. Like I said, and all the people I've seen leave, it's only been two, which I think is a pretty good ratio.
Now, when you're doing the initial intake assessment of somebody, you talked about financial and age qualifications. Do you assess people's, their personality? Are they going to be a good fit or are they not? And if you do, how often do you tell somebody, no, we don't think you'd fit in with PACE?
The biggest thing for us is always going to be, are they safe? That is it. Because think like in assisted living, if you have a mental health issue, they don't want you moving in. That is not a reason to not enroll in PACE if you have a mental health issue. Um, the state or CMS, who runs the whole Medicaid thing, has very strict guidelines on why we can deny somebody, and we have to put it in writing. And it really comes down to, are they safe in their home? If this is somebody who their dementia is to the point where they cannot be left alone at all, they could walk out the door and get hurt, disappear, something bad could happen. That is probably someone who's not safe in our home. Um, that is the number one reason we would disqualify somebody, is that they just are not safe. They have, we stick to the four guidelines. So, but we have to really, the clinical team has to really come together and determine if they're safe or not safe. So like I said, the gentleman who had been recently, he was in a skilled nursing facility. He wanted to go home, but because his building didn't have an elevator and he didn't live on the first floor, he was not a safe discharge, because if there had been a fire, he could not have gotten out of the building. So would always be the number one reason. But mental health, addiction, all the things that would disqualify you from a skilled nurse, an assisted living would not disqualify you from PACE.
Well, if you decide somebody isn't safe, what do you do? I mean, do you contact somebody in the county or the Virginia Department of Health or
Yeah, we'll talk to the county and let them know, but we always talk to them about the waiver program, the CCC plus waiver, where they can have home care brought into their homes, where that is paid through through the Medicaid. So, and that agency determines how many hours of care they need. So, and there's a lot of people who use that program, especially for someone who just needs, like someone with a high level, much further in their journey with dementia, who needs probably 8 to 10 hours of care, maybe even overnight because the family's still working. That is someone who's going to be better qualified for the CCC plus waiver. Our home care is not set up to be, as many of you know, a home care agency will go in for like 4 or 5 hours that you're paying them to be there for 4 or 5. Our home care is not set up to be like that. Our home care is to go in, get the tasks, and get you either on the bus to come to our center or wherever you are in your journey. We don't spend the day with people because we have the center for them to come to. So that there is sometimes just a level of care that we cannot provide. Someone who needs 24/7 care, that is not someone we could provide care for.
okay, and you touched on this before, but could you go back over how PACE works for somebody on Medicare but who doesn't qualify for Medicaid due to income and assets?
It becomes a private pay option where they have to privately pay $8,100 a month. That unfortunately is the only way.
But that does get them all of the services that you guys offer, right?
Correct. Correct. If they didn't have Medicare, it would be even more. So the fact they have Medicare covers some of the expenses. Um, so, but yeah, it's $8,100 without Medicaid.
Question, what amenities are there at your center beyond the medical? Is there, food prep and meal service and, a games room and things like that, or
So,
what all do you have?
so we serve lunch to everybody who comes. So we also have snacks, but we serve lunch to everybody who comes during the day. We have showers here. So if someone didn't get a shower at home for whatever reason or had an accident and need to be showered, so we have showers. We do have a section where the participants come in and hang out. Some are doing activities, some are socializing. I have my group, which I call my Romeo group, which is my retired older men eating out. So I have my group of men who I go visit with every day that sit together. Some like to watch TV, others are just on their own because there's such a different level of cognitive among people. So some are much higher levels of cognitive impairments and some have very little. So they find their people of who they're going to do. They eat lunch with them. There's activities going on. We have a recreational therapist. So some are doing exercises. Some are playing board games. A couple ladies who just like to swap books back and forth with each other. So.
All right. Well, does anybody else have any more questions? Now, if somebody's, say, living here in Arlington and they want to go to one of the senior centers, will you guys pick them up and take them to the senior center and pick them up and bring them
No,
home?
not at this point. The only things we're doing are medical appointments at this point.
Okay.
But if they need help with grocery shopping, our social worker will help to set up delivery for them. But you guys handle that. You should just, I think we have a participant who we've registered with you all that we pay for them to be part of your program. Um, but yeah. But I've had cell phones delivered to my house because they always seem to deliver them here too late. So they come to my house when the participant has lost their cell phone. We get them a new cell phone because they need to have a phone. So I know it's a lot to try and comprehend the first time you hear it all. And then also I often hear it's too good to be true.
And you said you're in the Mark Center?
Yes.
Okay.
Yeah. Right there, right on Boulevard. I would say, you know where Clyde's are? We're directly across the street from Clyde's.
Yep.
That seems to be the spot everyone knows.
Yeah, it sounds like we might need to arrange an A&V field trip sometime.
Yeah. Yep. And just like I said, we just had Mary Alice came over to visit. We had a great time. And it was funny, one of the people she helps with all of a sudden walked around the corner and she recognized Mary Alice and she walked and she obviously knows me, so we had a nice chat with her. So, so it's great.
Gary,
Yes.
do they enroll an organization to have their members be with them as a prospective members in the future, like the ANV?
I'm not sure I understand the question.
The organization, somehow ANV has several members in it. Does the PACE take advantage of enrolling an organization to be part of the PACE group?
Yes. Yes, we do have members that are part of the Arlington Village.
Thanks.
Yeah. Because it's a nice addition to other services that you offer that help our participants live their best lives.
Thank you.
So if somebody living here is going to move somewhere else where there's a PACE, do you guys just facilitate a transfer?
Yep. We just had it happen. We had two people move down to North Carolina and we helped connect them to the PACE program down there. I have someone who's moving up from the Virginia-based PACE program. She moved up here, so she's transferring from that PACE program to our PACE program, and I have another one transferring from New Jersey. So yeah, we all work together to help get the records that we need, everything that we need to set them up for success.
You said there's a PACE in Winchester. What about the rest of the Shenandoah Valley? Is there anything else there?
That's it. They got that whole bigger. It's a beautiful. It's Blue Ridge. So if you've ever heard of Blue Ridge Hospice, it's their PACE program. It is a beautiful building. It's about 15,000 square feet. They did a great job over there. I went out to see it. So, but yeah, no, they just do it by zip codes and getting them to move. And some states are much quicker at growing the area and others are slower. Virginia has been a little bit slower. Like when I go up to Massachusetts I was trying to get my aunt in a PACE program up there. There are PACE, it seems like on every corner. There's like, they just have enough, like everywhere. The whole, where I'm from was covered. It's the same company, but they had the whole area covered with PACE programs. It's great.
So Cynthia, let me see if I understand what you're saying. You are Cherry Blossom Pace, and Cherry Blossom Pace has two facilities, I think you said. You had another one in someplace out west. I didn't remember.
So Valor Health, which is who owns us, has two PACE programs in Oklahoma, and they have us. And
Okay.
then there are other companies that own, like there's a company called Innovage that's out of Colorado. They have PACE programs throughout the country, including a huge part of Virginia, like out in the Roanoke area. So yeah, so different people own the different PACE programs.
So if I wanted to find one, how would I find them?
The National PACE Alliance has a website. I think it's called NPA Online. They're actually right here in Alexandria. You go on that thing and I'll send it in the email to Gary and you just put in your zip code and it will let you know if there was a PACE program.
Okay.
We had one of our participants' daughters put out a tweet about how happy her mother was joining PACE. And that program and that got her sorority sister who works for Business Insider saw the tweet and saw that 20,000 people had commented on like, what's PACE, what's PACE, what's PACE. So she did an article on her that then was posted And my phone rang off the hook for days because they talked about us. So they all started calling Cherry Blossom PACE, and they're like, I'm in Texas, I'm in New York. How do I find a PACE program? So we were joking with the National PACE Alliance. The reason you've seen such an uptick is we kept sending people to their website to find where their local PACE program was. And I had one person who's joining our program who, when I asked, how did you hear about us? He goes, I saw you on Apple News. So that one woman's tweet turned into the best publicity we've ever gotten. So just her article about her being interviewed by her friend at the Business Insider.
Now, where in Boston are you from?
I'm from a town called Swampscott, which is north of Boston, about 20 minutes. So
I'm 20 minutes west.
oh, okay. So you know how to pack a car.
Yeah, I never had an accent, and neither do you.
My accent is on the word idea. I can always have an idea. I never can drop. I always have the R on that word. It makes my kids laugh.
Mine, occasionally mine comes out on whatever.
Oh, yeah.
Now, Cynthia, you said the various PACE programs are owned by different companies.
Yeah.
How much variation is there? Is there a uniform national standard for PACEs, or is it like villages where we say you've seen one village, you've seen one village, because they're all a little bit different?
Ours are very much because we're Medicaid and Medicare, CMS. So the Medicaid organization for the federal government has very strict rules on what we're allowed to do and what we're not allowed to do, and how we run everything. So, for example, we're not allowed to go knocking on people's doors to market us. We have to be invited in. We're not allowed to do anything like that. There are specific rules if somebody has a grievance. So the grievance can be something as simple as I didn't like the food, what we have to do with that grievance and what we have to do to notify people and how we have to, and the time frame. So yes, every PACE program is supposed to follow the exact same rules. Their buildings might look different, but how they run the PACE program should be the same everywhere, just because of the Medicaid and the federal guidelines. So even the way we write our enrollment agreement and the way we present our enrollment agreement is all laid out in that. So like your question is, someone's unhappy and they want to disenroll. We have to talk about that through the whole process of like, this is a voluntary program. If you decide you're unhappy, this is the process of how to disenroll and what we have to do to get you disenrolled. And when it becomes effective, like all those rules are the same for every PACE program.
All right. Pat Burke has posted a couple of links to the National PACE Alliance and to Cherry Blossom PACE. So while we're still on, anybody that wants to can copy those down.
Yeah. Like I said, I will also send you the document on if you do have veterans, just to how to help them getting engaged with the VA Medical Center, just so they know. Because the VA is not going to run out and tell you all the services they will provide. But if you find out about them, they're great. All right.
Well, not seeing any additional questions. And it's about 5 minutes to 11. So I don't know if anybody's got last comments or questions. I will say, Cynthia, you're right about it being an unknown gem. I was totally unaware that PACE even existed. So this was very informative to me.
Yeah, thank you. Like I said, I really appreciate the opportunity to talk about PACE. I love what we do, and I love being able to share the information. When I first came here, Wendy was actually one of the first people I reached out to say, "Hey, I'm here now." And then she was on a presentation I did with the Council of Aging in Arlington. So that's when she reached out. I'm like, I will come back every year if you'll have me. But yeah, so thank you.
Now you mentioned earlier that your brochure was in English, Spanish, and Amharic.
Yeah.
I would assume you also get other languages coming through your doors. So are you guys connected up with translation services or?
Yeah, we have a translating line for when we go. Yeah, we actually, September is PACE Awareness Month, and last year our recreational therapist realized between who works here and who's a member, we have 22 different countries represented in this building, which I thought was a really cool statistic to figure out. So, I said, I really appreciate this opportunity.
Well,
Okay.
so what do you think, Carolyn? Should we
I
call it a
think,
day?
I think we should call it a day. Thank you, everybody, for joining us. And Cynthia, thank you very much for coming and talking to us. I will be quite honest. You had come up as somebody to have on Coffee and Conversations, but I couldn't understand what you did. So when I would look at your website, so I was having a hard time with it, but I really appreciate this.
It's really difficult to explain it without talking a lot about it. And even then, like I said, I've had professionals come into this building and go, I just didn't understand what you could do here. I've people who work in skilled nursing facilities come in and take a tour and go, I had no idea what you could do in this building. So yeah, it's a lot to
Well,
say.
thank you very much. We greatly appreciate it.
Thank you for having me. I really appreciate the opportunity.
All
Yeah,
righty.
have a great day. Stay cool.
You too. Take care, everybody.